Andrea was diagnosed at the age of 18 months in America. They told us that it was a borderline autism and that if we just commenced early intervention and therapy, that Andrea will come out of it and go to mainstream school. Andrea was doing quite well until we moved to Abuja and she started having seizures. So my friend said, well, you have to come over and do assessment. We're preparing to go, and some days she's restless. She won't sleep on time. So I just thought it was one of those days, and I went upstairs, put her to sleep, and I lay down on the other bed with her, but she got up and pushed me out of her room and shut the door. She does that when she wants to sleep. I said, okay, she's now ready to sleep. So I left her, went downstairs, and I didn't hear any noise again. So I went back upstairs to check on her, only for me to find her face down on the mattress. So I turned her over and found out that her skin color had changed. And I called my friend in America, and she said that it meant she had lost oxygen. I should test her pulse, which I did. She still had a pulse. She said, start pumping her heart, and then, to make sure that her heart is still, on. And we went straight to Cedar-Crest Hospital. They checked her. They found out that she still had a pulse, and the doctor was supposed to. Normally, if you take someone who is even, you think the person is dead, the little that they do in advanced countries where the medical treatment is, supposed to be what it is to use what they call a defibrillator to jack her. And the defibrillator will tell you whether you should pump or not. So the minimum they could have done at Cedar-Crest, which they refused to do, was to bring out their defibrillator and use it on Andrea. When I saw the doctor wasn't listening to me, I said, if you won't use the defibrillator, I'm going to do it myself. I'll jump on the bed and start pumping her. And he looked at me and said, you'll only end up injuring Andrea or injuring her. So I left and I was just watching. Then like 15-20 minutes after pacing around, he wasn't in a hurry. He was just doing like someone who was just, just checking somebody who just walked in, not an emergency. He now turns to me and said, your daughter has passed. And she would throw tantrums, bite you, remove your glasses. She used to do a lot. Once her period is coming, she could remove her sanitary towel and throw it from the window. And all those things we complained about. But for me now, I miss those things. And I beg God every day to say to myself that, anything to do with autism, I must identify myself with it. And that